Hello guys, and welcome to Mugure's World. Today we are going to discuss a very interesting topic, and a serious one for that matter. And I am going to talk about this topic from a mom's experience, from a personal experience, not from a medical point of view. It's a medical issue, and before you do anything, please get help from a medical profession. Well, karibu sana. Before we continue, please hit that subscribe button. Call as many women as possible who are first-time moms to listen to this, to educate themselves about this and learn something today. What are we going to discuss today is postpartum preeclampsia. I'm going to talk about this from a personal point of view, from a personal experience. I am a mom of three adorable children, and I am glad I'm still here to take care of them. I am that lucky woman that was saved because I took keen action immediately I realized I was not well. I am going to talk about this because I have had postpartum preeclampsia not once, but twice. And if I survived this, you still can survive. You also can survive. You also can help one mama survive this. So let's dive right into it. What is postpartum preeclampsia? Postpartum preeclampsia is a condition that comes immediately you give birth. Between a few hours after giving birth to a few weeks postpartum. How is it characterized? It is characterized by high blood pressure, the pressures that are 140, 146, 150, over 90, 91, 92, and that. The normal blood pressure is 120 over 80. But when it's 140 over 90 and above, then that is high blood pressure. And if you've just given birth, then that is postpartum preeclampsia. Yes, now we are on the same level, on the same page. Sawa, tuendele. So, how will you know that you are experiencing postpartum preeclampsia? I am going to, as I said, I'm going to talk about talk about it from my own personal experience. And if you experience any of these symptoms, please seek medical attention. I am not a medic, and I will not advise you from a medical point of view. These are the things that will make you realize that there's something wrong. First, before we go to the characteristics or the symptoms of postpartum preeclampsia, let me advise that if you are postpartum, especially from CS, these are things that it's not easy for you to realize because number one, you are still under medication. Number two, your body is still numb from the whatever, what is it called? The numbing of the CS. So you may not realize as soon as you're supposed to realize. I am not sure about normal delivery women, but what I'm going to talk about is from a point of view of a CS mom. So I am a CS mom, and it's not like I woke up and realized, yes, something is wrong. No, it's not easy for you to realize. Now, what are the symptoms that you as a CS mom, you are still under medication, you are still under painkillers, your body is still numb? What will tell you, what will alert you that something is wrong? Number one, your vision will change. You will start seeing blurry vision. When you start seeing blurry vision, that is number one click, something is wrong. Sometimes even you just lose like temporal loss of sight. Temporal loss of sight. That is the word that I should use. So blurry vision, you cannot send a text, like literal. When you want to send a text or read a text, it is blurry. You are seeing like hizo marudurudu ama hizo mashilingi ndo unaona. So it's not clear. So you'll not be able to send text messages. You'll not be able to read, like go to your social media sites and scroll through. It is not easy. It is not possible at that point. Number 2, you will see your face is swollen. Your hands are still swollen. 3-4 days later, your hands are still swollen. Your feet are still swollen, like you are swollen, the way you were getting swollen when you were still pregnant. But now this is post. You've just given birth. Maybe just before you left hospital, the swollen had gone down. But now it is back. It never went down. So you're still swollen. For me, my face was swollen, and my hands and feet were swollen. And then I started feeling like my face was, one side was pulling the other. Like, the way you start feeling like, kuna venye, my face is not like asymmetrical. Yani, it's not, my eyes, one eye was like closing and the other one was open. So when I look in the mirror in the morning when I'm showering, I realized something is wrong with my face. Then I realized my face is swollen, and of course the blurry vision. Another thing is now your stomach. I don't know if you will feel your stomach because you are still under the painkillers. Maybe not. So another thing maybe that will make you realize is shortness of breath. You go to the washroom, you come from the washroom to your bedroom, and you're breathing like you're going to die. Those are 3 most important things that will make you realize, because these other things are now headache. You may not feel the headaches because you are still under medication, you're still under painkillers. So maybe that one is not going to be very possible for you to find out, to make you note there's something wrong. But these 3 things now, swelling and shortness of breath and vision, those are 3 indicators. If you're keen enough, you will realize there's something wrong with me, and then you have to go find medical attention as soon as possible. These other things maybe need headache, and then pain on the lower on the right side of your lungs. You will start feeling pain. This one is not like everyone will notice because they're still under medication. So if you note these 3 things, especially these 3 things that I've said, it is time for you to go and be checked. Maybe you can just run to the nearest pharmacy and take your blood pressure. If you can get the blood pressure equipment, please, this is the time. Take your blood pressure. How do you treat postpartum preeclampsia? Postpartum preeclampsia can be treated, and you can get healed completely, and you're out of blood pressure medication kabisa. So it is treated by you taking the blood pressure medication. When they realize you have high blood pressure and your urine has a lot of protein, you'll be given blood pressure medication. So maybe you will start with taking 3 tablets in a day. Then you go, as your blood pressure stabilizes, you go, and then eventually you will stop taking the blood pressure medication. So it is treatable, and you can heal completely from it. If you follow the advice from the doctor, you will get healed completely. How do you prevent this? Postpartum preeclampsia can be prevented, but you cannot prevent it when you've already given birth. You start preventing it when you are pregnant by, number 1, having an active lifestyle. When you're pregnant, if you're an active person, you normally do exercise, your life is not a sedentary lifestyle. Please continue having an active lifestyle. If you have an active lifestyle, these things, you will not experience them. Another thing is eat healthy diet. If you're eating healthy diet, this postpartum preeclampsia can be prevented. You ask yourself, what is the trigger that now triggers this postpartum preeclampsia? For me, for those 9 months that I was pregnant, most of it I was on bed rest, and that may have been the biggest trigger for my postpartum preeclampsia. I was on bed rest for quite a long time. I don't even remember when I wasn't on bed rest. I think I was on bed rest throughout. throughout the pregnancy. So I had a sedentary lifestyle, and that is a risk, the highest risk factor for postpartum preeclampsia. So this postpartum preeclampsia is treatable, is preventable. If you go on with your normal life, healthy lifestyle, eat healthy, you will be safe. But for those mamas that now it is here, what do you do? And you cannot even realize the first time. This condition has taken lives of people that I know, has taken lives of mothers who left infants 2 weeks, 3 weeks, 1 week in old infants. So it is very close to my heart because we don't want to lose many women. I don't want to lose any friend through this. I don't want to lose any person, any mother in this world because of postpartum preeclampsia. And not just because of postpartum preeclampsia, because they didn't know that they have postpartum preeclampsia. That is why I'm coming out today to tell the world that postpartum preeclampsia is real and is taking lives of many women that you don't know. If you know a mother who has just given birth, please visit them, check on them, advise them, look at how they are doing. Maybe they are swollen, they are having blurry vision, and they will not realize because now this is something that, high blood pressure is a silent killer. So if there is no one to help you and you are a first-time mom maybe, and all these things, you will not know. So if you can help a mommy, if you can visit a mommy who has just given birth and see how they are doing, you will save a life. So what are the risk factors of postpartum preeclampsia? The risks are many. One, you can have postpartum eclampsia, now full-blown high blood pressure. Number 2, you can have difficulty in your blood clotting because now your livers and other organs have been damaged. You will have a lot of damaged red blood cells through the liver. So if your red blood cells are damaged, you are not going to be functioning normally. You all know what red blood cells do in your body. So if your red blood cells are now affected, they are not being produced the normal way, now your body, your organs, you start shutting down. And it is fatal. If you have blood clots, they block your blood from flowing viscerally from your feet to your head. Then you get the stroke and maybe you die. You can get seizures. Is it Caesar or Caesar? Whatever that is. Whatever. I am not a medical doctor. So you can get seizures just because now maybe your blood is not clotting well. A nerve has broken, all these. You can get stroke. And that is where I am telling you my face was not like, symmetrical. It was like, yeah. So if you don't get medical attention, all these things can happen. And it's not like a walk in the park. You can just lose your life like that. So it is very, very important that you begin as a mom, you begin as a dad to a first-time mom, a husband to a first-time mom, and everyone around in the family. Please look out, watch out for these symptoms that you can notice, that you can see someone complaining about, and get medical attention as soon as possible. It is risky and it is fatal. Women are dying out there because they don't know. Not because of postpartum preeclampsia, because they don't know, or they didn't get the medical attention as soon as they were supposed to get to. If you don't get medical attention as soon as possible, then it can go to a full-blown high blood pressure, and all these things may happen. From Mugure's world, it was nice talking to you about this. It was nice helping one mom. It was nice touching one soul that maybe is going through all this and they don't know. To help me reach many moms, please like this video, subscribe to this channel and share to many women as possible, so that when they are going through all this, they will know what and when to seek medical attention. From Ugure's World, nawapenda sana, and bye bye.